I think ठीक ही आ रहा ना?
हाँ आ रहा.
Okay, आप ही करिए just in case, right?
हाँ नहीं.
साउंड नहीं आया.
साउंड नहीं आया भावना के उसमें अभी ऑन नहीं कर. कंप्यूटर साउंड बोल के क्लिक कर लो.
I'm just sending.
पूरे फैकल्टी को मैं इसके लिए होस्ट बना दिया. You can do.
I'm just sending.
Interrupt also. पूरे फैकल्टी को.
No interruption.
Yeah, am I audible also?
Yes, you are audible.
Yes.
Yeah. Thank you.
Right.
Manoj, this is Naina here.
Yeah,
I think I tried once because उनका ऑडियो नहीं सुने आया, तो मैं ट्राई करती हूँ.
ओके, नहीं मैं यहाँ करता हूँ, तुम लोग उसको देख के रखो.
ओके.
No, that is because you've turned on your mic, right? If you switch that off, then we can hear the PPT's audio.
एक बार मेरे को अलाउ करो बोलो.
Manoj, please allow Brijdesh inside the group.
नहीं it got disconnected. मेरा वो हुआ था.
I think we got disconnected. You have to re-admit him. I think he got lost. Bhavna ji, you can try probably by logging in. Computer audio is what you need.
Yes, you have to computer audio click करना. Nitesh, Nishit, Vinu. Naval has come. Good. Naval has come. Dinesh, Nitesh, Naval is also here. Very good. चलो दोनों को मैं co-host बना दे रहा हूँ. Nitesh make a co-host. Yes. Naval make co-host. Mate. Very good. We are all full now. So, yeah. So shall I? Now it is the 7:30.
Just hold on. We have more people. I am going live on YouTube in a couple of minutes.
Okay, Brijdesh. Okay. Hello, Naval.
Good evening. Hello. Good evening, everyone.
Nitesh is to log in now.
Nitesh is also logged in.
चलो नवल तुम्हारा टेस्ट कर लिए.
हाँ टेस्ट कर लिया मैं.
हाँ चलो तो नो प्रॉब्लम.
Okay.
So, Manoj, you're going to share, right, the screen with everybody?
No, you have to share with yours this thing.
Yeah, I can do it on my own, but once the person logs out, then we'll be able to do.
Yes, yeah. Yes. Once the speaker stops sharing, then you have to start share.
Yeah, done.
Yeah, I have admitted everybody now.
Yeah.
So we are 60.
We are live on YouTube now.
Good.
Hello, very good.
So I'm muting everybody now. So request the entire audience to stay muted. So all the audience can ask questions by typing the questions in the chat box, and we will take questions from the chat box at the end of all the talks. So till that time, all the entire audience will be muted and you won't be able to unmute yourself. Only after the talks end, we will permit you to unmute it. In the meantime, the best way out is to type your questions after each talk and send it. And after the end of the talks, I will read out the questions and the respective speaker will answer your queries. Okay. Another 2 minutes, we will start the program. I'm admitting more people. Bhavna, can you do one favor? Like once I start the thing, if more people come into the waiting room, you please admit. You are the co-host. You just have to tap the admit button. I will also do from here, just in case I miss out. You can admit more people.
Sure, Manoj, I can do that.
Yeah. So Dineshda, shall I start?
Yes, Manoj, go ahead.
Okay.
Shri Ganeshaya Namaha.
And welcome everyone. It is my proud privilege to convene the symposium on care in COVID time, organized by the Medical and Health Subcommittee of HMK and Dr. S.N. Mathur Memorial Trust. The symposium this evening is in the backdrop of the present pandemic due to COVID coronavirus worldwide and to acquaint our Biradri people, both in India and abroad, about the various manifestations, prevention and Medicare in case of COVID infection. The meeting today is due to the help and guidance of our President of HMK, Dr. Dinesh Raj Mathur. I welcome the Chairperson, Dr. Dinesh Raj, President HMK, Dr. Vimal Rai, an eminent physician and Chairperson of S.N. Mathur Memorial Trust, and Dr. Rajwant Pratap, a well-known endocrinologist, for participation in this event. I welcome all the eminent panel doctors of today's symposium for their valuable advice and guidance regarding the different manifestations, prevention and treatment of COVID, and to create an awareness among our Biradri people. I thank all the members of HMK guidance team and the organizing members of HMK medical team and the organizing secretary, Dr. Manoj Chandra, for organizing this event. I now request Dr. Dinesh Raj, President HMK, to welcome and also speak about S.N. Mathur Memorial Trust. Thank you.
Dr. Dinesh Raj, to please, President HMK, to please unmute and speak, give the welcome address now.
Okay, can you hear us? Manoj?
Yes, yes, you can. Proceed.
Well, good evening, ladies and gentlemen. Hope you all are doing well by following the advisory of COVID-19. We, the HMK Managing Committee members, had big plans to organize health camps and hands-on workshops in health sectors. Also, we had planned to revive for the S.N. Mathur Memorial Health Camp, but could not do so due to the pandemic. However, we have planned a seminar on the most burning topic of today, COVID-19, in collaboration with Dr. S.N. Mathur Memorial Trust. You all are well aware that this trust has been organizing annual camps for our community members and help them in monitoring their health and timely management. Many patients were diagnosed for the first time in this camp. Well, I think this is the best occasion to remember Dr. S.N. Mathur, who was one of the most eminent doctors of our community. He excelled in education by getting the most prestigious degree from UK MRCP. After returning to India, he served in different capacities to reach the highest post of Director of Medical Services, Government of Andhra Pradesh. He was also one of the most popular physicians and helped the Biradri members in the health sector. So I welcome the family of Dr. Shanti Narayan Mathur, the trust members under Dr. Vimal Rai's presidentship, and all the Biradri members to enjoy the program which our Biradri doctors have put together to share their knowledge and experience on coronavirus. Thank you. Dr. Manoj.
Good evening. Today I am going to speak on microbiology and molecular diagnosis of coronavirus. Introduction. Coronaviruses are a group of related RNA viruses that cause diseases in mammals and birds. The name coronavirus is derived from the Latin word corona, meaning crown or wreath. They cause respiratory tract infections ranging from mild to lethal. There are many different kinds of coronaviruses. A newly identified coronavirus, SARS-CoV-2, has caused worldwide pandemic of respiratory illness called COVID-19. History. COVID-19 virus, one of the RNA-containing coronaviruses, was first discovered from an outbreak of pneumonia in Wuhan city, Hubei province in China in December 2019. This outbreak was linked to a large seafood and the live animal market in Wuhan, suggesting a zoonotic origin of the virus from bats, camels, snakes, and pangolins, etc., to humans, and subsequently from humans to human. Geographical distribution. It is worldwide in distribution. Though started in China, spread worldwide, involving more than 180 countries globally, and continuing its spread, being the fastest spreading virus of this century. Habitat. It affects the respiratory system mainly, as also cardiovascular and gastrointestinal systems. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Structure. The size of the virus varies between 60 to 140 nanometers in diameter. Coronaviruses have extraordinarily large single-stranded genomes. Coronavirus particles are surrounded by fatty outer layer called envelope and usually appear spherical as seen under an electron microscope with a crown or corona of club-shaped protein spike protruding on their surface as seen in the picture. The envelope is composed mainly of lipids, which can be destroyed with alcohol or soap. Hence, we are recommending sanitizers with alcohol percentage, 60% alcohol. This slide shows the internal structure of the coronavirus. Pathophysiology. The incubation period ranges from 1 to 14 days. That is from the time of entry of the virus to the signs and symptoms. The median being 5 days, but transmission may be possible during the incubation period. The protein spikes of the coronavirus latch on to the human cells, then undergo structural change that allows the viral membrane to fuse with the cell membrane of the human host, involving the viral entry and release of RNA into the cytoplasm for replication, resulting in the multiplication of viruses in the body, leading to an increased viral load, which ultimately produced the disease. Testing for COVID-19. Two kinds of tests are available for COVID-19. Antigen test and antibody test. Antigen test, these tests tell if one has a current infection. There are two methods, rapid antigen test and real-time RT-PCR test. Antibody test. This test tells if one had a past infection. Rapid antigen test. The rapid antigen test is a nasopharyngeal swab test that directly detects the presence or absence of coronavirus antigen in the patient's body, generating diagnostic result within 30 minutes. This test is designed to detect the specific proteins, nucleocapsid, phosphoproteins, and spike glycoprotein in the virus which are visible on the surface. Those who test negative for COVID-19 by rapid antigen test should be definitely tested sequentially by RT-PCR test to rule out of the infection, whereas a positive test should be considered a true positive test and does not need reconfirmation by RT-PCR test as advised by ICMR. Real-time RT-PCR is a gold standard test. PCR method is used widely for carrying out molecular-based diagnostic tests for various diseases. The real-time RT-PCR is suitable to detect the COVID-19 virus as it contains only ribonucleic acid. RT-PCR stands for reverse transcriptase polymerase chain reaction. It is the most sensitive technique for messenger RNA detection. It quantifies the presence of a particular genetic material of the virus. The real-time RT-PCR is loaded with fluorescent dyes as markers. It helps investigators to analyze the results without delay. RT-PCR test detects the COVID-19 virus after nasopharyngeal swab is collected from the patient. It detects the virus even if the viral load is less. Antibody detection test. This test is done in patients who were infected by COVID-19. It's a serological test to see whether the immune system, the body's defense against illness, has responded to the infection by producing the antibodies. The test looks for one or both kinds of antibodies like IgM and IgG. IgM antibodies which appears first and disappears first. IgG antibodies which are more likely to show up later. In most cases, IgG antibodies are produced about 14 days after symptoms starts and stays in the blood long after the infection goes away. So that's all from me. Stay safe and be happy. Thank you.
The next we move on to Dr. Naval Chandra. He will be speaking about the clinical features and differential diagnosis. Over to you, Naval. You can share screen now.
Yes. Are you able to see my screen?
Yes, yes. You can proceed.
Okay. Right.
Sure.
Good evening, one and all. And I'll just, yeah. Are you able to see the full screen now?
Yes.
Okay. So thank you, HMK and Dr. S.N. Mathur Memorial Symposia Committee for having me give this brief overview of the symptoms of COVID. I'm sure you would agree, last 9 months of this pandemic has driven us all to this, level of so much of uncertainties in life, coming across situations which we have never felt or dealt with in our lifespan, something very new to us. And it's been a rather learning process every day, as long as what are the symptoms coming along, what are the, strategies, the ICMR regulations, the new guidelines, which tend to get, updated every few months. So it's been a rather long battle with this particular virus, and I'm very happy to share just a brief overview of the symptoms, the differential to the symptoms of COVID, and a little bit about home isolation, what we're supposed to do. So you'd already agree that there's so many, over the world, we've got people who have we've lost over 4 lakh lives in over 200 nations all over the world. As of 1st December, over 4.6 lakh cases have been reported in India, over 1.4 lakh deaths, and out of which the good thing is we've seen over 88 lakh cases who have totally recovered. So the good thing about this virus is you see that the recovery rates have been very, very good, and in fact, our state, we have been able to keep the mortality rate to as low as 0.92%, to say about 1%. So ICMR also mentioned that 80% of the cases in India are either asymptomatic or mild, 15% being moderate, and 5% being in critical situations. So just to tell you, over the world, we have roughly about 67 lakh cases all over, recovered over 40, I would say not 60, like 6.75 million people all over, and over 4.4 million who have recovered, and causing death of about 15 lakh people or so. So compared to some of the other states, as I mentioned, our state is doing pretty well. We've got a recovery rate of around 99%. We've just got about 0.92 to 1% mortality in our state. And these are some of the other states where relatively the mortality and the death rates have been a little higher. So what are the symptoms once we come across a patient, say, coming with most common symptoms, agree, you all know, are fever, patient presenting with low to moderate grade fevers, presenting with dry cough, which is a very typical symptom, a sense of tiredness. We are seeing that going on post-COVID. Recovery also is taking a whole lot of time, and we are seeing people having this sense of tiredness prevailing for months even after being tested negative. Among the less common aches and pains, the typical sense of soreness in the throat, at the back of your throat, and very classical two symptoms I would wish to emphasize here. One is diarrhea, and the other one is loss of taste and smell. You all would agree, so many years, so many months, you are seeing people who keep asking you this question, am I dealing with a regular flu or do I have COVID? So it's been rather a learning process for all of us. But these two symptoms, patients presenting with diarrhea and the loss of taste or smell, classically seen in COVID, more so the taste or smell loss, and that clinches us our diagnosis, saying that you're probably dealing with COVID. Well, coming to the serious symptoms, once you have lung involvement, you would get situations where people develop difficulty in breathing, their oxygen levels come down, a sense of tightness in the chest. I'm sure those who have also had mild symptoms at some stage or the other at home in quarantine would have experienced this sense of, some sort of a pressure in the chest. So I have seen this among a lot of people who are presented even with very, very mild symptoms. And of course, people who present with strokes, as the tertiary care institute, we are seeing a lot of people who are coming with acute, CVAs, and then you test them and they come positive for COVID. So what does one need to do? Seek immediate medical attention if you're serious symptoms, and always call before visiting a doctor or the health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. And at an average, it takes about 5 to 6 days from when someone is infected with the virus for symptoms to show up. As Dr. Dinesh sir said, that it can take up to, you've got the period up to even 14 days. Well, this is a good differentiation among four viruses we have dealt with over the last few years. I thought I should share this slide. And you would see that all these, you've either got the influenza-like illness versus the H1N1 we came across, which is still there, prevalent. We have the SARS picture, and then and now we're dealing with COVID. So all these group of patients, they can come with fever, myalgias, they may have some sort of a cough, and then lack of energy. They may present with soreness in the throat, and they may or may not present with breathlessness. Of course, we all know influenza-like, we generally wouldn't expect people to get breathless because it's more of our upper respiratory, but other three you would expect, once there is lung involvement, they may get breathless. But very, very classically, as I had mentioned, the loss of smell and taste, which we see in COVID, which is not there in the other three viruses, and also the presence of diarrhea. So a few more differentiating points. You've got the COVID versus the classical influenza-like illness. Patients often present with fever, and you've got fatigue, which may present. Cough is very classically dry cough. In both sneezing, I would say you would see more, though less, among the influenza-like rather than with COVID. Aches and pains are seen more with the COVID scenarios rather than a simple influenza-like illness. And well, the classical stuffy nose or the runny nose, I would say that the influenza-like illness, you will see rather a runny nose rather than in COVID, where you get a sense of stuffiness in your nose and you may not have much of secretions dribbling down the nose. Sore throat is seen in both. As I mentioned in the previous slide, diarrhea and loss of taste and smell are very pathognomic of COVID. So you see these compared to the other influenza-like illnesses where you would not get these presentations. But to mention, among the pediatric age group, we are seeing presentations of diarrhea coming in with patients with influenza also. So what should one do once you are tested positive? You have a person who's tested positive but has no symptoms, or a person who's a close contact to a tested positive person. What should they do? Well, get into home quarantine. By what do I mean by the contact? Contact is a person living in the same household as a COVID case, or a person having had direct physical contact with the COVID-19 case, or his or her infectious secretions without the recommended PPE, or even there is a breach in the PPE. A person who was in a close environment or had a face-to-face contact with a COVID-19 case at a distance of within 1 meter, including what we see in air travel. So, the home quarantine measures. Well, what should one do? The patient should stay in a well-ventilated single room, preferably with an attached toilet. If another family member needs to stay in the same room, situations where we're dealing with COVID positive in elderly people or people who are, for some reason, physically challenged, we need help. We have to have somebody sharing the room with them to take care of them. But I would advise them to maintain at least a 1 meter distance between both the patient and the contact person. We'll need to stay away from elderly people, pregnant women, especially children and people with comorbidities. We are all aware they are more prone for having a more severe form of COVID. That is what our experience has taught us. So try having a less contact with these group of people, restrict his or her movement within the house. And I just wish to add this on a very, lighter scale. Please don't go for weddings, or, don't think that you need to run into funerals to give your condolences, because these have been the clusters from where we have picked up a lot of COVID. Well, follow the public health measures at all time. Wash hands as often thoroughly with soap and water. Alcohol-based hand sanitizers. Avoid sharing household items like dishes, drinking glasses, cups, eating utensils. So keep all these separate for the patient. Wear a surgical mask at all time. The mask should be changed 6 to 8 hours and then should be disposed of, never to be reused. Masks used by patient care givers, close contact during home quarantine care should be, they should be disinfected using ordinary bleach solution or sodium hypochlorite solution and then disposed of by either burning them or deep burial. Of course, that is a bit of an impractical thing what we come across, but definitely not to use them beyond 6 to 8 hours. That is what is important. And for proper disposal. So use mask should be considered as a potentially infected source. And if symptoms appear like cough, fever, difficulty in breathing, he or she should immediately inform the nearest healthcare, or inform your hospital, or inform your treating physician whom you are in touch with, and get yourself admitted into the hospital. Some of the things one should follow is, please, I would advise anybody in home quarantine to keep a pulse oximeter with you. Look out for these symptoms, what I have said. Do the 6-minute walk test. We are advising to be done once every 8 to 10 hours at least, where you have to monitor your saturation levels. And once you develop symptoms of cough, fever, and your saturations are around 94 or so, it is time that you contact your physician and get yourself admitted into one of the hospitals there. So what are the instructions for the family members of persons being home quarantined? Only an assigned family member should be tasked with taking care of such a person. Avoid shaking the soil, linen, or direct contact with the skin. Use disposable gloves when cleaning the surfaces or handling the soil, linen. Wash hands after removing gloves. Visitors not to be allowed. And in case the person being quarantined becomes symptomatic, all his close contacts will be home quarantined for about 14 days and followed up for an additional 14 days or till the report of such case turns out negative on lab testing. So clean and disinfect frequently. Touch surfaces in the quarantined person's room, like the bed frames, tables, etc. Clean and disinfect toilet surfaces. I know it's a bit of an issue to do it daily, but definitely would recommend it to be done at least once in 3 to 4 days. And clean the clothes and other linen used by the person separately using common household detergents and dry. Home quarantine period is for 14 days. We recommend 17 days from the contact with a confirmed case, or earlier if the suspected case of whom the index person is a contact turns out negative on laboratory testing. So I would like to end my talk here stating safety isn't expensive, it's priceless, it's almost 2021. Don't let anyone waste your time. Thank you, one and all.
Naval, you can stop sharing your screen. Yeah. Now I would request Dr. Pradeep to come to share his screen and speak about the diagnosis and pathogenesis of COVID.
Good evening, everybody. I'm here to talk about pathogenesis and diagnosis of COVID-19. As we all know, this pandemic began in December 2019 when the first case of unknown cause of pneumonia was reported from Wuhan on 8th December. On 31st December, China reported a cluster of cases to WHO, which on 7th January identified the causative agent as a novel coronavirus. On the 30th of January, India reported its first case from Kerala from a student who had traveled back from China. On 11th February, the disease was given the name of COVID-19 and the virus was named as SARS-CoV-2. On 11th of March, the WHO declared it a global pandemic. Let us discuss about the pathogenesis or how this virus affects the lung. The virus enters the body through the droplets that are released from an infected person when he speaks, coughs, or sneezes. These droplets, after entering the lung, attach to the cells inside the lung. The virus then enters the lung, in which it multiplies and creates several copies. Then the virus destroys the cell and gets released further into the lung, thereby spreading the infection. At the same time, the body's immune system attacks this infected area. This also kills, along with the virus, many normal cells of the lung. The immune cells also release a lot of chemicals into the lung and the blood, which help in killing the virus, but in excess can also harm the lung. This leads to the alveoli or the gas-filled pockets in the lung to be filled by a fluid, preventing the oxygen from entering the blood from the air. This causes a typical symptom of breathlessness and causes what we know as a severe disease. Most cases are mild or asymptomatic, about more than 80%. Severe cases, those which require hospitalization, only about 15%. And critical cases, those which require ICU care or ventilator, only about 5%. The risk factors for severe disease are age more than 65 years. Males tend to have more severe disease than females. Comorbidities such as cardiovascular disease, cancers, renal disease, diabetes, and obesity have worse prognosis. And blood group of A is found to have more severe disease, whereas O blood group have lesser number of COVID cases and lesser severe disease. Symptoms, as already told, mainly involve mild symptoms such as dry cough, headache, body pains, fever, sore throat. The breathlessness usually appears after 1 week of initial symptoms. Patients also present with diarrhea, nausea, and vomiting, and the typical symptom of loss of smell and taste, which is very specific for this disease. Coming to the diagnosis, we'll deal in 4 subheadings, that is whom to test, when to test, which test to choose, and is a repeat test or a negative test needed. Coming to whom to test, all the patients with above mentioned symptoms need to be tested. And all asymptomatic direct contacts with a confirmed case need to be tested. All contacts include both contacts from the workplace and at home, and all patients who have come within 6 feet of the patient without wearing a mask and have spent more than 15 minutes with the patient. All asymptomatic high-risk individuals in containment zones also need to be tested. And all asymptomatic high-risk patients who are going to be hospitalized or seeking any invasive procedures need to be tested. When to test? Symptomatic patients can be tested at any time. The sooner, the better. While asymptomatic contact should be tested between day 5 and day 10 of coming into contact with the index case. Testing before 5 days can give you a false negative result. Now, which test to choose? As already been told, there are about 4 tests available to us to diagnose COVID-19. The gold standard or the most commonly available test is the PCR test. We detect genetic material of the virus. It is done on a nasal and throat swab and takes about 6 to 8 hours. Though this is the gold standard, even this test can give about 5 to 40% of false negative results. That means that even if you test negative, it is not confirmed that you do not have COVID-19. The other test available is the antigen test. It detects the proteins on the virus. It is used as a screening test, again performed on a nasal or a throat swab. It is a rapid test. Results come in about 5 to 30 minutes. The false negative test of this test is about 40 to 70%. The other test available is the antibody test. This is not meant for diagnosis. This only gives an idea if you have previously had an infection. The same similar antibodies can occur in your blood because of other coronaviruses which are frequently seen in common colds. The test takes about 15 minutes to 2 hours to come and detects 2 types of antibodies, IgM and IgG. IgM is seen in active infection, develops between 3 to 7 days after infections. And IgG is generally a long-term antibody which provides immunity from reinfection and develops between 2 to 3 weeks after getting the infection. The 4th test available is the CT chest. This is the most sensitive test. That means it can detect the most number of cases. However, the changes you see on the CT scan, they are not very specific. That means they are not seen only in COVID cases, may be seen in other diseases also. Hence, this test is not recommended for diagnosis or screening. It is meant only to be done in hospitalized patients to understand the extent of the disease and further monitor what is known as COVID fibrosis. However, it can be used in certain cases in which you get a rapid RT-PCR or rapid test negative, but still you have a high suspicion that the patient has COVID-19. Now, a lot of people are getting CT scans done, and the report is being given as CORAD score and a severity score. The CORAD score basically indicates the level of suspicion for COVID-19 and not the severity of the disease. It is rated from 1 to 6, where higher the number, the more the suspicion of COVID-19. The other number mentioned in CT reports is the CT severity score. It is given out of 25 or 40 and indicates the extent of involvement of the lung. That means higher the number, the more extensive involvement of the lung. However, this severity does not correlate to the mortality of the disease. Hence, should not be given much importance. This is the ICMR algorithm for diagnosis in outpatients. The ICMR first recommends the rapid antigen test to be done. If it is positive, the patient is reported as positive and treated. If negative and the patient continues to have symptoms, a RT-PCR test is recommended. However, if the patient is asymptomatic, he can be left alone, or if when he develops symptoms, he needs to undergo a repeat antigen test or a RT-PCR. However, these are government guidelines given in view of limited resources in India. However, if one is undergoing a test at their own expense, it is better to go for the gold standard test, that is the RT-PCR. Now coming to the burning question, is a repeat test or a negative test needed at the end of the quarantine period or at discharge point? The ICMR, CDC, WHO all recommend against a negative test. The reason being, the RT-PCR is a genetic test, and the genetic material of the dead virus can continue to remain in the throat of the person for up to 12 weeks. Hence, the report might keep coming positive even though no live virus may be inside the body. And research has shown that in mild cases, after 10 days, there is negligible amount of infectivity or viral shedding, which can extend up to 20 days in severe cases. Hence, the government recommends a period of 17 days of isolation for mild to moderate cases, and after which no negative test or repeat test is needed, and patient can resume their normal life. Thank you.
Thank you, Dr. Pradeep. You can stop sharing your screen. Now it is my pleasure to invite senior endocrinologist Dr. Rajwan Pratap to speak about diabetes care in COVID.
Dear distinguished Biratari members, today it is my great pleasure and privilege to present before you the interrelationship between diabetes and COVID-19 disease. My presentation will illustrate to you the way diabetes impacts COVID-19 disease and also the way COVID-19 disease impacts the diabetes management and control. In the same context, I would also think that it is pertinent that we should know what are the myths and what are the facts that we myths about this relationship and what are the facts which we know up till now. Now, marriage is always a sweet thing, but if you get diabetes and get involved with SARS-CoV virus, it is like marrying a wrong person. It is the COVID-19 disease. Now, every day new and new cases are being reported and innumerable deaths occur in diabetes. That brings us to the question whether diabetics are more likely to develop COVID-19. We have almost 73 million diabetics all over India, and this figure is likely to multiply in due course of time. Almost it will become double. What is more important to understand is 15% of this diabetic population fail to achieve a good diabetic control. They fail to achieve the criteria for good diabetic control, whereas 85% patients fail to meet this criteria. Only 15% meet the criteria of good diabetes control. It is these 85% of diabetic patients which who are uncontrolled diabetes. If your diabetes is under good control, you stand same chances as a non-diabetic person in contracting COVID-19 disease. You don't have more chances. But if your diabetes is not under control, then you have the chances of contracting this COVID-19 disease much more than the general population. So it is, what is more important to understand is the complications that are associated with this disease once you are a diabetic. The prognosis is very bad, worst outcomes do occur, and therefore I would sum up by telling that it is not the question of greater chances of contracting COVID-19, but it is the watchfulness of the COVID conditions. Now, the paradox is that everyone thinks that only diabetic patients have got high blood sugars. It is not true. People who are non-diabetic also at times can develop very high blood sugars. Those who are under stress, those who are on steroids for treatment of diseases like rheumatoid arthritis, or those who are on heavy doses of steroids in respiratory distress syndromes. They all develop very high sugars, and high blood sugars have got a high risk of death in diabetic patients. Now, it is established that 25% of the patients who were admitted with severe COVID-19 disease in the hospitals either have a newly detected diabetes or they are a known diabetics on treatment. So hyperglycemia, that is high blood sugars, was the main reason for the severity of the COVID-19 symptoms. And 40% of deaths, COVID-19 deaths patients were found to have had diabetes. So if we are facing with such a dreaded disease, what are the precautions we should take even before the COVID-19 strikes to us? We should store enough amount of high protein food snacks to for emergency use. We should have maximum refills of insulin and tablets so that you don't have to run to the pharmacies. You should also increase the blood sugar testing, at least for a long, in 1 week, at least twice you should do a complete diabetic checkup. We usually do a fasting and post-lunch blood sugar only, but we should do fasting and post-lunch blood sugar, post-breakfast blood sugar, a pre-lunch blood sugar, a post-lunch blood sugar, a pre-dinner blood sugar, and a post-dinner blood sugar to know the glycemic variability. And this is very important in managing diabetes. So at least you should do twice a week or once a week the complete diabetic profile. Other days you can resort to only fasting and post-breakfast blood sugar. You should always keep a finger pulse oximeter handy to detect any fall in the oxygen saturation, which we need you to consult a doctor or get admitted in the hospital. And it is not a bad idea to keep a bottle of urine dipsticks, which are known as keto sticks. These sticks are useful for detecting a complication of diabetes known as diabetic ketoacidosis, with which the patient becomes probably unconscious and needs hospitalization. So keto sticks should also be kept with us. And always have the phone number of the physician and the insurance company in case you need their help. And have emergency contacts on speed dial on your cell phone, so that in emergency you will have to contact one of the person on whom you can depend to take care of you, move you to the hospital, and look after the other aspects. And a virtual media plan should be established in case you get quarantined, whether you are quarantined in the house or you are quarantined in the hospital. And it is not a bad idea that everybody should take influenza and pneumonia vaccination, because these are the two infections which has been highlighted before. They produce pneumonias and cause lung damage. And COVID-19 disease is a lung disease basically. So coupled with pre-existing pneumonial infections, COVID-19 will play a lot of havocs. Uncontrolled diabetics, in our system, we have got a mechanism to fight the viruses and bacteria. Any bacteria or virus enters into the body, our body produces antibodies to fight the infection. And this is known as immune response. And uncontrolled diabetic patients, the immune response is decreased. It becomes harder for the body to fight the viruses, and it also slows down the healing response. Therefore, it takes long time for hospitalization. And almost 7.3% of deaths from COVID-19 related complications have been reported. Nobody dies of COVID-19 disease, but it is the complications which take them away. So in patients, if your diabetes is under good control, you stand the same chance as other person in the general population to develop COVID-19 disease. Your immune response is same as that of any general person once you have the diabetes under very tight control. But high blood sugars weaken the immune system, and therefore our body has got less ability to fight infections. They are highly prone to secondary infections like pneumococcal or other virus infections which have been cited. And this leads to high admission to intensive care units and the high need of ventilatory support because of the fall in oxygen saturation. You have been already told about how SARS affects the body. I will briefly mention that there is a protein in our body known as ACE2. And SARS virus combines with this protein and enters into the human cells, and various organs get affected. It causes multiple organ failure, but predominantly it affects the lungs and the respiratory tract. And severe other infections which I mentioned, the pneumonias, they produce more respiratory distress and make you go on to the ventilator. Now, whenever the virus enters into our body, it rapidly multiplies in geometric proportions, and that produces complications. And these complications can lead to rapidly evolving kidney failure, or a fall in blood pressure necessitating intravenous pressor agents to boost up your blood pressure, severe respiratory distress, and the need for high dose of steroids. High dose of steroids again produce high blood sugars, and high blood sugars again predispose to the complication of COVID-19. And they will also need a variable nutritional support. Now, in diabetic patients have got damage to the vessels of the eye, and this is known as diabetic retinopathy. And what is the relation of diabetic retinopathy to COVID-19 disease? I am going to elaborate. So already there is a pre-existing damage to the vessels. These vessels are not only present in the retina, that is the eye, but are in other tissues of our body, especially the lungs are highly vascular. So pre-existing vessel damage coupled with the viral inflammatory surge will produce severe complications. And the patients are more prone to severe breathing problems and 5 times more likelihood of intubation and ventilatory support. So it is very important that you should keep your diabetes under control. All these things you can avoid by keeping your diabetes under tight control. All uncontrolled diabetic patients are predisposed to these complications. And a word about obesity. Adult obesity is increasing in nowadays, and how obesity puts you at risk for COVID-19 infection. I have highlighted almost 6 reasons. One is obesity is linked to the immune response. Obesity creates underlying inflammatory condition. Obesity decreases the lung capacity and the vital capacity. Obesity worsens outcome of COVID-19. Obesity triples the risk of hospitalization, and obesity causes COVID-19 deaths by 48%. So we have to be very careful that we should not become obese and try to reduce the weight. Now, there is also diet problem in patients who are suffering from COVID-19, because as just now highlighted, one of the symptoms of COVID-19 is a loss of appetite, a loss of taste sensation, or diarrhea. All these things will cause the patient to stop eating proper nutritious diet, and therefore the existing drugs will are more prone to push this patient into very low sugars, which we call as hypoglycemia. Hypoglycemia is dangerous for a diabetic patient. But if there is no loss of appetite, then you can continue the same drugs. At the same time, a word of caution to maintain hydration. You should drink at least 250 ml of water every 2 hours to match the fluid loss which occurs due to fever as well as due to very high blood sugars. Very high blood sugars produces diuresis. You pass a lot of urine, you lose a lot of water in the urine. So both by evaporation and respiratory evaporation, from skin evaporation, and from the gastrointestinal tract, there is a increased loss of water. So you have to maintain the hydration by drinking adequate amount of fluids. Now, COVID pandemic contributes to the stress, anxiety, and depression, which further complicates diabetic control and cause difficulties in day-to-day management of diabetes in achieving an optimum control of diabetes. Now, patients are under stress, patients are anxious, they are depressed. Anxiety is about their health. Anxiety is about the financial situation, because if you get admitted in a hospital, you have to shell out a lot of money to pay for your treatment. And the anxiety is about the family support. Who will support you? How they will support you? And the anxiety is also the fear of suffering, and death also produces a lot of mental problems. Therefore, what is more important? Improving diabetes control is more important, and it is a critical measure to improve the outcomes in COVID-19 disease. As I told you, patients don't die of COVID-19 disease, they die of complications. and complications occur with uncontrolled diabetes. So improving diabetes control reduces the secondary infections, reduces renal dysfunction, reduces your ICU stay, reduces the ventilatory dependence for some time. Then a word about our ladies who become pregnant, and once they develop diabetes in pregnancy, we call it as gestational diabetes. The pandemic is only about 1 year, and there is a limited data about how COVID-19 affects the pregnant woman, the fetus, and the newborn. There is very little evidence that SARS-CoV-19 virus passes into the amniotic fluid to infect the fetus, and there is no evidence that it contaminates the breast milk. So till such time as we get more data on this aspect about the effect of COVID on the pregnant woman, fetus, and the newborn, prevention is better than cure. We know that there is a high maternal risk in COVID-19 infection in patients who are diabetic. Almost 7.3% deaths from COVID-19 related complications are reported in gestational diabetes. But one good thing to know is the SARS-CoV-2 virus does not pass into the fetus, does not enter into the amniotic fluid in which the fetus lies, and it is not secreted into the breast milk. So breast milk, it is not secreted in the breast milk. So we have to encourage all COVID mothers to encourage breastfeeding. And the advantages are that breast milk is rich in nutrients. It is a great source of protective antibodies and hormones, and it is needed for the strong and early development of the child. Therefore, even WHO recommends breastfeeding, but with caution. The cautions have already been highlighted. Just to refresh, regular hand wash before handling the baby, wear a mask, preferably an N95 mask when feeding the infant, and stay 2 meters away from feeding, 2 meters away after you finish the feeding. Then lastly, should COVID-19 diabetic mothers and child be separated with an idea to reduce the risk of COVID-19 infection to the newborn. This is, it rests upon the healthcare physician who has to decide based on the level of infection and the mother's wishes. He has to take a decision, barring the mother from following all the necessary precautions. She can feed the infant because mother's wish is always there to feed the child. So thank you very much for the patient hearing. Questions will take up at the end of the session. Over to you, Manoj Chandra.
Yeah, thank you, Dr. Rajan Pratap, for that extensive exposition about care of diabetes. I request you to stop sharing your screen at the top. Yeah, I request Dr. Nitesh Pratap to speak about the gastrointestinal manifestations of COVID. Over to you, Nitesh.
Thank you, Doctor. So I'll be talking today about GI manifestations of COVID. So we have already seen that the respiratory tract is one of the most common tract involved, with patients presenting with fever and respiratory symptoms. But even GI tract and the liver are also affected, and almost 50% of the patients whom we are seeing with COVID will have digestive symptoms. Now we have already seen that the transmission is mainly through aerosols, spray, when the person coughs, sneezes. This is the major source how the virus spreads. But the other is, the thing which has been debated is, does the digestive system also serve as an alternative route for COVID infection? Because there is a lot of thing going about the fomites. But the evidence says that COVID infection is not transmitted via food or food packaging, number one. Number two is, it has not been detected in drinking water, because most of the drinking water is treated. So COVID-19 is not transmitted with drinking water. The third is that transmission through stool is not very clear, because initially there were reports that the number of cases are increasing is because spread through stool. But most of the places in which they have seen is that though the virus is seen in the stool, sometimes it is seen up till almost 50 days after the infection, but it is not a very significant factor for spread of infection. So you have to understand that with food and water, the spread is not much. It is predominantly through the aerosols when a person coughs, speaks, or sneezes. Now, we have seen that 80% of the patients who have COVID-19 are asymptomatic. Some people have got a severe disease. Some people require critical care. Now, what are the different factors which are associated with this type of symptoms? Because it is behaving very variedly in each type of group of patients. They say that it is underlying medical condition, as Dr. Rajan has told, diabetes. Some say it is a genetic. Older age group of the patients are one of the major things which have been implicated. But when I see from a gastroenterologist point of view, one more thing which has interestingly come up is the use of proton pump inhibitors, that is the antacids which we commonly use. These include omeprazole, pantoprazole, and lansoprazole. Most of the people take these antacids without knowing the side effects, and many studies have shown that these patients with COVID-19 who are taking proton pump inhibitors can have are at an increased risk of developing COVID infection when compared to people who are not on these. But historeceptor antagonists like ranitidine, famotidine are not at higher risk. So it is very important that if a person is taking it, which is medically indicated, they continue. But in those people who are taking just antacids without having a compelling indication, they should stop it during this pandemic. So we have seen the manifestations of COVID. It can involve any part of the body from eye to brain, throat, lungs. And when I come to the GI, predominantly it is decrease in appetite, nausea, vomiting, loose motions, and abdominal pain, which we see in these patients. So as everybody before me have empathized, that it is the lack of appetite which is the most common symptom we are seeing in these patients. Almost we see in 79%. Loose motions are in around 34%, vomiting in 4%, and pain abdomen in 2%. Now, even the liver involvement is seen in almost 15 to 50% of these patients. They can have with jaundice. When we do blood tests for them, that is the liver function test in which we look for blood bilirubin, we look for liver enzymes, they can be abnormal in this group. But one good thing is that most of the patients have got a limited disease, and liver failure is very rare in this group of patients. And in those patients who are critical, who are requiring ICU, this type of abnormal liver function tests are more common. Now, whom to test in a patient with GI involvement? Mainly it is patients who have got fever, who have got respiratory symptoms, who have got decreased appetite, change in taste or smell sensation, and diarrhea. These are the group of patients in whom we are going to do RT-PCR to look for COVID. Now, if you come for the management, like most of the viral infections, the main treatment in this group is usually symptomatic. If it's an infectious diarrhea, we start them with antidiarrheal drugs like loperamide. Then we give hydration. It is very important that they should be hydrated properly. If they are vomiting, we give vomiting anti-emetic drugs, and vitamin supplementations are very important, especially vitamin C and D. Another option is very important is food safety, because a lot of you has been going on about food. It is very important that people who are catering to food industry, that the volunteers and the staff should have a good personal hygiene. Everybody, the hand washing is very important. Sanitize using alcohol-based sanitizers. The food should be heated, and you should prevent cross-contamination between raw and cooked food. It is very important to eat anything which is outside, which is cooked. Many things have been told that many foods have been implicated that they prevent, but nothing has been shown to prevent. It is mainly the safe practices which help to prevent the spread of infection. So mainly the prevention is having a distance of 6 feet apart, hand washing for 20 seconds, stay in home when you are sick, and always protect yourself wearing mask. Many of the foods we have been known as to boost the immune system, which are rich in zinc, iron, and vitamin C. So my take-home message is GI involvement is very common. We see almost in 50% of the patients. The role of digestive system as an alternative route for transmission is not clear. We should not take antacids if there is no compelling indication. So if you are on just prophylactic antacids without any strong indication, you have to stop them. The most common symptom we see from GI point of view in patients with COVID is loss of appetite followed by nausea, vomiting, and diarrhea. And the treatment is mainly symptomatic, and the main thing is prevention. I would like to thank for the chance given me for the talk. Thank you.
Thank you, Dr. Nitesh Pratap. You highlighted the importance of indiscriminate use of antacids, which is a good take-home message for all of us, that we should not go for it. Now I have to play the video of Dr. Sunil Kumar, cardiologist. Just give me 1 second.
Good evening. At the outset, I would like to thank the President, HFA, and the Medical and Health Committee for giving me an opportunity to take part in this symposium. Good evening. At the outset, I would like to thank the President, HMK, and the Medical and Health Subcommittee for giving me an opportunity to take part in this COVID symposium. Today, I am going to speak on cardiac involvement in COVID. When COVID started 1 year back, most of the concentration was on lung involvement and the shortage of ventilators, etc. But as the cases increased, it became clear that not only lungs, but COVID involves every organ system in the body, particularly the heart, which may be responsible for a large part of the morbidity and mortality due to COVID. Right from the beginning, doctors realized that the susceptibility to COVID as well as the severity of COVID infection was more pronounced in patients who had underlying risk factors like advanced age, hypertension, diabetes, past history of heart disease, obesity, and cancer. So these are the people who should take special precautions to avoid being affected by COVID infection. But then it was soon realized that COVID can affect the heart in many other ways. Let's look into this in some detail. The mode of entry of the coronavirus into the body is mostly through the respiratory tract, as has been detailed by the previous speakers. Once it invades the lungs, it spills out into the body and affects the other organs. The heart is affected in many ways. By direct invasion of the coronavirus, by the inflammatory response which takes place in the body in response to the infection, by reduced oxygen in the blood, by thickening of the blood vessels, leading to formation of clots in the lungs and in the blood supply system of the heart. Once the coronavirus reaches the heart, it invades the cells by locking on to an ACE2 receptor, which are found in abundance in the heart. Like a lock and key mechanism, the ACE2 inhibitor and the virus get into the cardiac cells and start multiplying and damaging the heart muscles. This also triggers an inflammatory response from the body, and both these factors together result in enlargement and weakness of the heart, a condition which we call myocarditis, which, if left unchecked, can lead to heart failure and maybe even death. The second way in which the heart is affected is by accumulation of fluid on the outside of the heart called pericarditis and pericardial effusion. The third most important way in which coronavirus affects the heart is by forming clots in the big and small arteries supplying blood to the heart muscle cells. This can lead to angina and heart attack. The blockages inside the heart happen because the blood becomes very thick, and this can be measured by a special test called the D-dimer test. The onset of angina, heart attack, or myocarditis can be diagnosed by measuring what is called troponin and BNP in the blood. Another important effect of the coronavirus on the heart is the effect on the pacemaker system, which can lead to severe problems with heart rate and heart rhythm. This can be a serious condition and can lead to sudden cardiac death. All the above effects of corona on the heart are compounded by the severe hypoxia, that is, a reduction of oxygen in the heart secondary to lung involvement. Also, besides the direct effect of the virus, many of the cardiac complications happen due to the body's inflammatory response, which can be measured in the blood by doing tests like CRP, LDH, ferritin, interleukin 6. It is thus clear that COVID can affect the heart in many ways, and all of these can be potentially life-threatening. Myocarditis and heart failure can cause breathlessness at rest or on minimal exertion, inability to walk even short distances, fatigue, and chest pain. These symptoms are frequently mistaken for lung symptoms unless specifically looked for. Therefore, ECG and 2D echo with blood test, as I have detailed before, are mandatory in patients suffering from moderate to severe COVID. Heart attack and angina present in the COVID patient in the same way as it presents in the non-COVID patient with chest pain and ECG changes, and should be treated with the same aggressiveness. Once cardiac complications develop, it is mandatory to give antiviral therapy like remdesivir and steroids along with specific cardiac treatment. One important treatment which should be started early in the course of the disease is blood thinners to prevent blood clots from forming, particularly if the D-dimer is high. Initially, injections should be started, followed by oral blood thinners like apixaban and rivaroxaban, which should be continued till the D-dimer returns to absolute normalcy. In spite of recognition and treatment of cardiac involvement, the mortality in these patients remains high. And cardiac involvement is the main reason why the mortality continued to remain high even in patients who received state-of-the-art treatment in US and in Europe. A few last words about long-term involvement of the heart in COVID. Surprisingly, it has been found that more than 25% of patients who recover from severe COVID infection have long-term problems in the heart, particularly those patients who had developed heart failure, heart attack, or weakness of the heart. These patients will require long-term follow-up and treatment. Let me stress here again that the cardiac involvement that we have talked about can take place not only in people who have underlying risk factors, but also in normal people who develop severe COVID. The problems arising in the heart are so serious and so common that Professor Tidwell, a leading cardiologist from US, has called COVID as a cardiovascular disease. I will be happy to answer any questions from the audience. Thank you for your attention.
Thank you, Dr. Sunil. That was a very brief and up to the point exposition about involvement of cardiac care. So now we move on to the next talk. This is by Dr. Rajiv. Just give me a minute to open his presentation.
Good evening. I could not be with you all live, but I'm saying this recorded version. Children's health in COVID times is of utmost importance. They get easily infected because of their proximity to adults who travel outside their homes for work, for pleasure, for meetings and gatherings, bring it home, infect children. Since children are mostly in lockdown and at home, they get infected, and the most common problems which they arise is with simple cough, cold, and loose motions and vomitings, which might look apparently as simple diseases, but could be an early sign of our COVID. Children are an important mode of spread of COVID because of their low symptoms, but they are highly infectious because they cough, sneeze, they pass urine and do motions, and if that hygiene is not maintained, could pass it on to the adults at home and would be dangerous for the elderly at home. So keeping in mind that we are living in a COVID pandemic, it is important that we look after the health of the children. Most important will be the precautions we have to take to prevent COVID infection in children. Basic hygiene and diet is the most important. Hygiene in terms that we should wash our hands with simple soap and water for 3 minutes. That is a very effective way to prevent COVID. Wash your hands up to the elbows. Wash your face if you go out or if you have been in contact with anybody or playing games with children. You play in, your playtime is over, you play out, your playtime is over, wash your hands and face. Wearing a mask in children is of great importance. But the problem is children do not keep their mask on for long times. And we do not recommend that children have masks on their face for more than 2 hours. And that too, they need to be in a supervised way so that the parents keep a track on the breathing of the child. What we recommend is a simple 3-layered mask if you are not in contact with COVID. And children don't like to have masks on their face, especially these dull masks, because they think it's a hindrance to them. What would be interesting is if you get these kind of children masks, with emojis, or you could just buy the mask and paint on them. Probably that would make children very happy, you have these on them, they will be very excited to have this kind of mask. And mask application is very important. This is the way the mask has to be worn. Clip on, not this, not this. So please make sure that your children, when they put on the mask, they enjoy it and act it like a play. Avoid playing in closed doors, closed window environments. Let the children breathe and let the air flow out. Avoid children's parties. Sanitize their hands when they go out or come in, or they have been in contact with other children. Another most important thing is to train your children to put a facial tissue when they cough or sneeze. If you try to enforce them, they will not do it. You should do it like a play. Then they will definitely participate. The other important thing is trimming nails. Your nail beds can become a source of COVID growth. So have their nails trimmed. The other important thing is diet. To improve diet, their diverse vegetables, meats have to be intaken, and citrus fruits, especially colored citrus fruits, have a bearing on immunity, development, and health, general health. So we recommend that you take a wide spectrum of food. Supplements in children are important to boost immunity, especially vitamin C, vitamin A, zinc, and vitamin D. Because of this prolonged lockdown, your child's vaccinations may have to be discontinued. We strongly recommend that you start revaccinating your children from where you stop, and I would strongly recommend that your children need to take influenza vaccine, which has a partial immunity against COVID. So please complete your vaccination. It's important that you recognize COVID early in children. And I'll just give you a simple what signs you will see of early COVID in children. Please read them. High-grade fever going beyond the third day, persistent vomiting and diarrhea, severe body pains, red rash over the body, red eyes, extreme tiredness, throat pain, dry cough with no running nose and difficulty in breathing. Now, I would like to even bear in, take you all in this mind that you need to look for danger signs in COVID. And some children come with this. Child looks very sick, very sleepy, drowsy, increasing difficulty in breathing, sweating, cold skin, and severe abdominal pain. There are three ways you can do this. Either you do home care if the symptoms are mild, which can be like any other upper respiratory infection. Give fluids, paracetamol, steam. Just be careful that you don't put the steam directly onto the face of the child because that can cause burns. The best way is to do telemedicine with your concerned doctor who would advise you on what to do. And if he recommends a COVID test, go and do it. Hospital visits should be avoided as much as possible. And if needed, only go to the hospitals for any type of treatment. Because children are in isolation for long times and not in contact with their friends or schools, they develop mental problems, psychological problems. So helping your children overcome these psychological problems is very important. Play with them, let them play home games, let them do creative works at home. Do not let them overspend time on cell phones and laptops, which they are already using for prolonged hours because of their teaching schedules. Finally, my message will be, take care of your children, save them, save yourselves, and whenever the vaccine comes, please do take it. Thank you.
Thank you, Dr. Rajiv, for that wonderful video that you made since you were traveling. I hope it is very useful for our community. Now it is my turn to speak about the ocular manifestations in COVID. Yeah. So hope you are all able to see. Dr. Dinesh, are you able to hear me?
Make it full screen, Manoj.
Okay, yeah, I have made it full screen.
Yeah, we are able to see.
Okay, fine. So since we are running behind schedule a bit, I would not take much of the time. As far as the eyes are involved, ocular manifestations, actually this is the last slide. I think I will open it again. Yeah, one second. Yeah, I have to stop share, then just give me a minute. Is it fine now?
Yeah, but last slide. This is the last slide.
Okay, okay. Yeah.
Yep.
So it is my proud privilege speaking about ocular manifestations, and I am indeed privileged to speak in the symposium in the name of late Dr. S.N. Mathur. And I'll be speaking about ocular manifestations in COVID times. Basically, these are of two types: ocular manifestation due to the disease per se, and the second thing is ocular manifestations due to the lifestyle changes. But since the focus of today's symposium is basically to discuss about the disease, I won't be covering the lifestyle changes that we need to adopt regarding the dry eyes, care of dry eyes, and the screen time, and etc. So let's move on. The route of infection as far as eyes are concerned, as other speakers have already pointed out, that the chief cause of infection is because of the presence of ACE2 receptor in the cell. The COVID virus enters into this cell with the help of a surface protease enzyme, and the ocular surface could potentially serve as a portal of entry through exposure to aerosol droplets. So it is likely that the SARS-CoV-2 has a low conjunctival replication. It is not proved beyond doubt that the conjunctiva is having a plenty ACE2 receptors, but it is very clear that the black portion of the eye that we call the iris and the uveal tissue, the retina inside the eye, they have plenty of ACE2 receptors. So another factor is the aerosol contamination. One is direct entry of the COVID virus into the conjunctival surface and causing conjunctivitis. Another factor is the aerosol contamination of the tears which reach the throat through the draining duct connecting the eye to the nose, what we call the nasolacrimal duct. Or it can be the other way around. The infection may travel from the nose to the eye. Together, these results indicate that ocular surface cells are susceptible to infection by SARS-CoV-2 virus and could therefore serve as a portal of entry as well as the reservoir for person-to-person transmission of the virus. So, the chief in the complaint that is seen about COVID as far as the ophthalmology patients are concerned is conjunctivitis. During the COVID-19 outbreak, conjunctivitis was reported as a manifestation of disease and the viral RNA was found in the patient's tears. The first reported case of COVID conjunctivitis affected a member of the Chinese panel for pneumonia who developed conjunctivitis and COVID after performing an inspection in the Wuhan fever clinic without wearing the eye protection. His eyes were not protected. He was in complete PPE, but his eyes were open and he got conjunctivitis. And because of conjunctivitis, he developed the proper COVID infection. And therefore, it is important to adopt safety practices to prevent infection and virus spread and to assume an extra caution behavior. When I started my practice after the lockdown on the 1st of June, I used this paraphernalia. I used a respirator. I used a 3M goggles over my spectacles inside. So it was really claustrophobic for me to begin with, but I got to use subsequently. Now, after passage of time, I have done away with the 3M goggles, but I am still, because of my spectacles, I still do have some ocular protection. The signs of conjunctivitis in COVID are no different from general viral conjunctivitis. What are the signs? What are the symptoms that you need to look out for? It is a bilateral conjunctival hyperemia. That means the redness of eyes. Number 2 is the chemosis. What is chemosis? It is accumulation of water beneath the conjunctiva and the eye swells up. The conjunctiva swells up. This is chemosis. Follicular reaction in the inside of the lid that we call tarsal conjunctiva. There are small follicle type of lesions here. Then epiphora is watery discharge, the watering of the eyes. Then mild eyelid edema is observed in such patients, and enlarged periocular or submaxillary lymph nodes. Lymph nodes are the things what we call Gandhi, just below, beside the ear and the submaxillary lymph nodes, in front of the ear as well as in the maxillary area. Patients affected by conjunctivitis, a conjunctival swab is generally obtained, and that is analyzed for RT-PCR, and that was shown as positive in some of the patients. So apart from the external infection by the way of infection through aerosol or droplet, through the tear or direct infection of the conjunctival cells, there is another route, that is in a COVID positive patient, there can be an endogenous spread. What do you mean by endogenous spread? Endogenous spread is spread from inside the body through the blood road to the eyes. So as I told you, the black portion of the eye, this is the iris. What we call is a component of the uveal tissues. In technical terms, we call it uveal tissues. Uveal tissues consists of the iris and the other parts of the eye, like choroid retina and the RPE cells, the retina. And they, as I told you, exhibit a high level of ACE receptors. So these tissues are highly prone for COVID infection in case the infection reaches that particular tissue. And the most frequent ocular manifestations are iridocyclitis. Iridocyclitis means infection of the iris. There are adhesions to the lens. They cause a lot of deformation of the tissues. Then papilledema is edema of the optic disc inside. Subconjunctival hemorrhage, especially in cases who are using prone position for long as prescribed by the ICMR guidelines, they are likely to develop infection, accumulation of blood, leakage of blood behind the conjunctiva, what we call subconjunctival hemorrhage, the conjunctival injection, and the vitreal floaters. Like if you see inside the eye, we see floaters in the vitreous cavity as a part of the ocular manifestation. Since COVID-19 is able to target vascular pericytes, expressing ACE2 viral infection could lead to complement-mediated endothelial cell dysfunction, microvascular damage, and thus ocular circular involvement. This was explained by Dr. Sunil Kumar also, that the ACE2 receptors are responsible for the virus to gain entry into the pericytes. What is pericytes? Pericytes are cells surrounding the vessels. So the vessels get involved, and that subsequently leads to coagulopathy. Coagulopathy is formation of embolus or thrombus inside the blood vessel. If they are formed in the heart vessels, you get a heart attack. If they are forming in other parts of the body, you get that kind of a, like if it is involving the nerves, you get neuropathy. And in eyes, if it causes a blockage of the main artery of the eye, the whole blood supply to the periphery, the entire retina is stopped, and as a result, you see gross pallor of the retina, just excluding the central portion of the eye, what we call macula. The red spot here, what we see inside, if the patient complains of sudden loss of vision, if you look inside the eye, we see this spot called what we call as a cherry red spot. The entire retina is pale. There is no proper blood supply. All the arteries are looking like they are attenuated. They are looking small in lumen. Whereas on the contrary, if this embolus blocks the vein of the main vein of the eye, what happens if the vein is blocked? Artery is pushing blood into the eye, but the vein is stopping the blood from flowing out of the eye vessel. So what happens? The blood leaks into this retina, and you see multiple hemorrhages. So this is basically a retinal artery occlusion, that is a vascular manifestation of COVID, and the retinal vein occlusion. If the vein gets occluded, we get this kind of a picture. So, to conclude, basically, I am restricting only to the disease components. What is it important? What is the take-home message for all lay people is nothing much. What usual symptoms you get, but be aware that the transmission of infection is possible through tears. Any sign of conjunctivitis associated with other COVID symptomatology should be viewed with suspicion. Always have a suspicion. Any ocular symptoms like recurring pain, redness, watering, or blurred vision should be reported, and an ophthalmic consultation should be taken. And sudden loss of vision warrants an emergency ophthalmic consultation. It is not sufficient to say if you are suddenly stop seeing one eye in the night, you say, okay, kal subah dekhenge. That is not the way. Emergency consultation is required, especially in central retinal renal artery occlusion, where we give a massage, we need to do a paracentesis to drain out some fluid, reduce the intraocular pressure so that the clot gets dislodged and the blood vessel supply is restored to the eye to prevent a permanent damage. Whereas in the vascular, if there is a blurred vision because of an obstruction in the veins, then possibly that may end up with moderate to severe sight loss. So we have to be careful about all these things. Basically, ocular involvement in COVID situation revolves around conjunctivitis, or if it is through the AS2 receptors, through endogenous spread involving the uveal tissues, the manifestations that I've shown you in the earlier slides, like iridocyclitis and retinal floaters. But if there is a coagulopathy, like so what analogy Dr. Sunil Kumar used in cardiac, what leads to heart attack, a similar situation if it occurs in the main artery or the main vein of the eye, then you need to have a emergency consultation and get your issue addressed. Thank you all for the patient hearing. So the next speaker will be Dr. Vimal Rai. I would like to invite Dr. Vimal Rai to share screen and speak about the clinical management of COVID.
You're on mute, you're on mute. Hello. नहीं हुआ
Yes, Vimalda, we are able to see your slide. Probably you are muted.
No, he's unable to unmute
and start speaking.
Host is unable to host it. Manoj Chandra blog. He is not. You put a presentation. Hello. उनका प्रॉब्लम नहीं है.
Hello.
You have to allow him to unmute. You have blocked unmute for all.
No, I have made him a co-host. No, okay. I'll do that. I'll do that.
Go back to the first slide and now unmute yourself. Hello? Can you hear me, Manoj? No. Hello? Unable to mute it. Unmute. Okay, now I think it's Hello? Hello?
नहीं उन्होंने खुद बोल रहे हैं उनका ही चल रहा था
नहीं स्लाइड्स का शेयर करने को
हाँ
स्लाइड्स प्रेजेंट कर रहा था
हाँ
लाइक क्लिक कर सब कंपोज करके कुछ में या समथिंग करके या अलग अलग व्यवस्था
नहीं आ फिर से म्यूट करें
ये है अनम्यूट नहीं इसको करे तो
काफी कर रहा था
रिफ्रेश अनम्यूट ही है
हेलो
हाँ ठीक है इट्स ओके या वी आर हियरिंग यू
Okay, at the outset, I would like to thank all the members who are taking part.
Please show slides. Please show slides.
बस गए बहुत सारे
स्लाइड आ गई फर्स्ट स्लाइड आ गई
let the Hello.
Start, Vimal, please start.
I would be talking on the management of COVID infection. I would like to tell the members or the audience that in very short time, I would make them quite professional in treating a case of COVID. What do you mean by management? The word management itself means how do you manage a case of COVID?
Mathur, नहीं दिख रहा ना slides?
We are able to see. I am able to see the slide.
We are not able to see.
Yeah. आपका view
slide नहीं दिख रही.
We are able to see.
Are you able to see the slide?
Yes, yes.
No, no, no.
I am able to see here.
No, we are not.
Okay.
Hey, so the slides are there. It's very clear.
Yeah.
It's clear.
Sunil, you just go to the view on your right side top and then you select side by side view. Side by side.
Okay, you can go ahead. No problem.
Okay, right.
That's all right.
I'm starting my lecture.
Yeah, Dr.
The first question that is asked is there any specific treatment for COVID-19? The answer is very emphatically no. There is no known specific drug to cure COVID-19 available as on date. So, ladies and gentlemen, do you think that COVID-19 is incurable? Again, my answer is no. Why? Because no specific drug does not mean that it is not curable. Treatment of COVID is based on treating the clinical symptoms and preventing the occurrence of early or late complications. On one side, we talk about the bad angle that COVID is not curable. On the other hand, if we really see the recovery rate of COVID, it is wonderful. 80% of the cases are asymptomatic or they have very mild symptoms which can be managed at home without any special care. 15% of the cases have mild to moderate symptoms that might require hospitalization for oxygen administration. Only 5% of cases have moderate to severe infection and require an intensive care unit or a ventilatory support. Of these, half of them may have mortality. That is what the WHO has reported, whereas the ICMR has reported that the mortality is 1.4. And as Nawal said that in our state of Hyderabad or Andhra Pradesh, it is 0.9%. So when we talk about management of COVID, we divide the management into two categories: general management, specific management. General management means a non-medical management. Specific management means management with drugs where the real effect of the doctor comes into the being. General management are quite common. Everybody knows about it, but I just repeat it. Isolation of the patient. Why? To prevent the viral transmission. Good and proper nutrition, optimal fluid intake, manage pre-existing comorbid conditions, diabetes, hypertension, renal failure, bronchial asthma, etc. And one of the important symptoms of both COVID and post-COVID era is reduced weakness. Encourage the patient to walk or do some exercises at home. In moderate to severe cases, care of the bowel, bladder, and back is important. When I use the word back, I also mean that seeing that the patient is in a prone position for quite a bit of time, those who are hospitalized, either in intensive care unit or otherwise, care needs to be taken to prevent catheter thrombosis, deep vein thrombosis, reduce ventilatory pneumonias, prevent gastrointestinal bleeding. Here, I would just like to tell Nitesh that he said PPI should not be used. I would also tell at this juncture that one of the things that we do whenever a patient is on ventilator or severe patient, proton pump inhibitors are used. Since cardiovascular manifestations are the most common cause of fatality, special care needs to be taken on that front. The most important thing in the general management is the psychological management. What do you mean by the psychological management? It is basically a three-way communication. And what is this three-way communication? One is doctor to the patient, doctor to the relatives, patient to the relatives. Now, doctor to the patient. Why? Most important thing is the doctor, if he goes there, put a hand on the patient's back, that gives him 50% comfort. You have to allay the anxiety of the patient, telling that yes, everything is good, you will definitely improve. Second thing is doctor versus relatives. Why do you want the relatives to come into the picture? As I always say, 3 P's in these relations with the doctor. First P is to tell the progress of the patient, how the patient is progressing. Second one is the prognosis. What would happen to the patient? When will he recover? Or would he have complication? Or would he not survive? The third one is to tell for tougher measures that a patient has to take. For example, the first tough measure that you will always like to talk is, when are you going to intubate a serious patient? The second tough measure is that we may be using a convalescent plasma for therapy. And the third one is always financial aspect, that how much would it cost a patient if you are using a drug, A, B drug, or a C drug. For example, one drug I will just tell, tocilizumab or Acmera, which cost about 40,000. There was a time when it was not available very freely. The cost in black market was 1 lakh rupees. So these are the things which we'll have to tell to the relatives from a doctor's point of view. The third one is the patient and relatives. You must always allow the relatives to talk to the patient by video conferencing. They may not come in direct contact with the patient, but video conferencing must always be allowed to see that the patient and the relatives are on the same page. Now, the basic treatment. The treatment protocols are based on ICMR and WHO recommendations. You say, why am I using two things, ICMR or WHO? Some of the things which ICMR says WHO may not accept, or vice versa. The treatment protocols depends upon the disease severity, whether it is mild, moderate, or severe. Why do we want to know about this thing? Is antiviral drugs are useful in mild to moderate cases, while immunosuppressant or anti-inflammatory drugs are useful in severe cases. The management differs at each stage of the disease. Now, let us talk about mild cases. When do you call mild? If a patient has only fever, a throat pain, then you call it as mild. And on examination, what do you find? The respiratory rate less than 24 per minute, SpO2 more than 95 per minute. That is oxygen saturation seen on oximetry. The drugs that can be used are only symptomatic, like paracetamol, antihistaminic like cetirizine, or Allegra. I have used the word instead of fexofenadine because most of you people are aware about Allegra rather than fexofenadine. And the third one is hydroxyquinoline. This is advocated by ICMR and not by WHO. From mild, we enter into the moderate cases. When do you call moderate cases? And it is at this point of time, I would like to tell the advice that we give to the patient. What is the advice that we give to the patient? One, if your cough increases, if you find difficulty in breathing, or if you find that shortness of breath has increased, if you find that your oxygen saturation is going below 95 or your heart rate is above 110, it's time that you get hospitalized. That you get hospitalized. And when you examine the respiratory rate is 24 per minute. In these moderate cases, we use what we call it as EUA, that is emergency use authorization drugs, like remdesivir, favipiravir, that is Fabiflu as you call it. Plus, we start prophylactic treatment with anticoagulants and use steroids, not orally but parenterally. Antibiotics should be used to prevent secondary infection. This type of patient, when they are in the hospital, you take an ECG every day, while other blood investigation, which can be taken every third day. Once the breathlessness increases, it goes on increasing, then you think that the pneumonia is also increasing. And you will find that the patient is having shortness of breath. This shortness of breath is because of low oxygenation, what you call it as hypoxia. And when you measure this people by oximetry, oxygen saturation is less than 90% at room air, or it should be less than 97% with supplemental oxygen. Ladies and gentlemen, the main treatment lies in the use of oxygen. What I call it as sequential use of oxygen. What is sequential use of oxygen? First, we give oxygen by nasal mark, high oxygen flow. That is, we give oxygen at a rate of 10 to 15 liters per minute. Normally, we give about 5 liters per minute, but here we give it at a rate of 10 to 15 liters per minute. If in spite of this, the oxygen saturation is not increasing, it is time that we put the patient on non-invasive ventilation, like BiPAP or this thing. I'm showing the icon also. You can see the icon showing thereby about non-invasive ventilation. And when non-invasive ventilation fails, oxygen saturation going down, it is time that we intubate the patient. The severe cases are all characterized by 3 or 4 important things. That is respiratory failure, sepsis or infection, shock, hypotension, volume is decreased in the body. So these are basically the things that we come across when we talk about critical cases. And it is at this juncture that we must understand what would be the prognosis of the patient. And the prognosis will depend upon how the patient is going to fight these infections. 1, use of injectable antibiotics. Are the antibiotics working or are they not working? 2, the volume is reduced. So fluid resuscitation is a must in these cases because patient has not been eating, patient has not been drinking. That is why he has gone into this state of affairs. And lastly, hypotension or low blood pressure. The treatment would be vasopressor drugs to increase BP. The last important thing in these cases of severe or critical cases is what is known as cytokine storm. What are cytokines? They are proteins which are secreted from the body to fight an infection. When you say that they are to fight an infection, why are we worried about? It is because in the initial stages, the amount of cytokines that are liberated are limited in amount, and that is why they are able to fight that infection. As the saying goes, too much is too bad. Too much amount of cytokines causes depression of immune system. And in these cases, we use immunosuppressive drugs like tocilizumab or Acmera, which I have told you some time back. A word about convalescent plasma therapy. People who have been hospitalized or people who go to the hospital, they would have heard from so many people that such a person has been given plasma. So what is this plasma? Plasma is the fluid component of blood that contains important body proteins. Body develops antibody against the virus on encountering an infection. Transferring these antibodies from recovered patient can help in treating the disease. This is what is known as convalescent plasma therapy. About 200 to 500 ml of plasma is taken from COVID recovered individual and transfused to the patient. It has been shown to be effective in many cases if used early. Do not delay. If you are planning to give plasma therapy, do it early. There is no point in giving it when the chips are down. And hence, the most important thing would be that when to give the plasma therapy. It is when the patient is deteriorating, the patient is on non-invasive ventilation, that you should think at that particular time to give this convalescent plasma therapy. So ladies and gentlemen, you all know now we are living a new life under the COVID banner. So bye-bye to the old life and bye-bye to all of you. Thank you very much, ladies and gentlemen.
Thank you, Dr. Vimal Rai, for that wonderful talk about the clinical management. Now, the next thing is I am going to present a video recorded by Sajid. Just give me half a minute to do that. I have to close it. Dr. Sajid is speaking today not as an ENT specialist. Dr. Sajid is going to speak as a personal perspective.
But as a patient. Good evening. Today I'm going to talk about COVID and a patient's perspective. Not as a doctor, but as a patient. The first thing which comes into our mind when you have a positive report showing that you have COVID is a shock. Why did I get it? When I was taking all precautions, I was staying away from any other COVID patient. I was wearing a mask, I was wearing a face shield, I was wearing gloves, I was wearing gowns, but still I got infected. Why? But that's now of no use, because once you're infected, you're infected. So what do we have to do now? First, inform all your contacts about who have come into contact with you and tell them to get themselves tested. And if they come negative, then to get the test repeated after 4 to 5 days, because sometimes we find that the test comes positive after a few days. The second thing is to get all the paraphernalia which you require to prevent any complications and for self-home monitoring. The first thing is a nice digital thermometer, not the infrared one, a BP apparatus, a pulse oximeter, and if possible, a glucometer to check the sugar levels. If the tests are done through the government, then a number is generated. And this is very important in case you require admission in any hospital. Also, this number is given to the government of Telangana, and they will give you a call every day for the next 40 look after to check on your welfare. And they also give you a number 104 which you can contact in case of any emergency. Important thing to remember is do not get disheartened. So immediately quarantine yourself wearing a mask. Do not come into contact with the other members of the house. Of course, until everyone is infected, then it's a free-for-all. One thing is very important. If you have any comorbidities like diabetes, hypertension, The regular medications must be continued. Please do not stop the medicines. Second, contact your local physician or the one whom you contact regularly and ask him what medicines to take for the treatment. That's what we did. We called Prathip and he immediately started our treatment. The important thing here is to look for any complications. Most of the people will be asymptomatic like we were, but you can have breathing difficulty, you can have chest pain, you have confusion, you can have cough, you can have loose motions, you can have diarrhea, and then these have to be treated separately. The most important thing is do not get disheartened, and all regular routine activities, maybe at a lesser scale, must be continued, because routine is very important to take your mind off all the tensions which come along with the COVID infection. BP, sugar, temperature, and SpO2 monitoring must be done on a regular basis. Most important thing is breathing exercise. Ensure that your lung capacity is good, you feel nice, and along with that, if possible, some yoga or gentle exercises like even walking in the room. That helps a lot, because exercise elevates the mood. Do not read any more about COVID, because whatever you read only about the complications, right? Only a few % of the patients will develop really severe complications which require hospital admission. Most do not require hospital admission, and they need just home quarantine, good rest, and that is enough. There are some problems associated with COVID which we all have. One is dry cough, and this dry cough can persist for a very long period of time. So what do we do for that? Steam inhalation, saltwater gargles, breathing exercises, and sips of hot water or even warm water. But the water should not be gulped out. Take it as small sips, because what happens if you take big gulps of water, you can have another bout of cough, which is not good. There's a feeling of lethargy, weakness. You don't want to do anything. But routine is what helps. Daddy used to say in the morning, even if you're not well, get up in the morning, get dressed, and go for your normal activities, and you will feel better. And we found that it helps. Small yoga exercises, don't overdo it. Never overdo it. Do small yoga exercises. They help in boosting your immunity, and also they make you feel good. If you're feeling very weak, do as much as possible. You need not overexert yourself. There's loss of taste, there's loss of smell. If you can't smell, you can't taste. There may be a bitter taste in the mouth. But whatever happens, you have to eat properly. If you don't eat properly, what is going to happen? You'll become weak, and then you get prone to infections. Why have that? So, you eat small frequent meals. If you don't like the taste, add some pickle, add some chutney or something. That helps. Hydrate yourself very well. Breathing exercises, very important. Even some exercise, walking in the room, that also helps. If you feel that your saturations are going down, you can do a 6-minute walk test where you walk for 6 minutes and check for saturations and see whether it goes below 92. If it goes below 92, please contact your doctor. Also, we have problems of severe headache. It really helps. If the blood pressure is deranged, please contact your doctor and ensure that proper medication is given. Loose motions are also another very, very important problem which we all have. So, ensure that maybe some curds, hydration should be good. See that you have some electrolytes. important thing here is if you have lots and lots of loose motions, then sometimes if there's dehydration, may need admission. Breathing difficulty is the one which is actually the most important problem with this condition, and for that we have to go to the hospital, because the earlier the treatment is started, the quicker will be the result. A lot of people suffer from fear, depression, and only watching maybe the Saas Bahu serials or talking to relatives, staying away from all these COVID-related talks. Yes, that does help. One problem with this is that you become a social outcast. You know, people think of you as untouchable, which is not a correct thing. Okay? And there's a certain period after which you become non-infective. After 17 days, usually you're not infective. And that's when the quarantine also stops. So my request to all these COVID-related talks, yes, that does help. One problem with this is that you become a social outcast. You know, people think of you as untouchable, which is not a correct thing. Okay? And there's a certain period after which you become non-infective. After 17 days, usually you're not infective. And that's when the quarantine also stops. So my request to everyone is, please don't treat the COVID patients as outcasts. Mingle with them, but give them some time. Not, of course, when they're infected. Even though the ICMR also now guidelines say that after 10 days, you can wear a mask and maintain a social distance of about 6 to 10 feet and stay in the same room, watch TV with them. You're not going to get infected. So please be careful, stay safe, and be sympathetic towards the COVID patients. Thank you.
So in a very clear and lucid way, Dr. Sajid explained about the patient's perspective, and which was very useful. He covered almost all the specialties. We as experts, we spoke about different diverse specialties, manifestations about COVID, and Sajid, as a patient's perspective, he made it so simple. He spoke so lucidly that he probably must have removed all sorts of anxieties from most of our hearts. Now I would like to invite Dr. Kapil, who is involved with the development of a vaccine. Now we have discussed about the disease. Now let's look into the future and hear about the vaccines from Dr. Kapil. Kapil, you can share screen.
Yeah. Yeah, hello, am I audible?
Yeah, you are audible. You just share your screen.
Yeah, I've shared.
No, we are not able to see the screen. Just give Kapil 30 seconds, he will come.
Is it coming now?
Yes, now we are able to see. You take it to show. Yes, start.
Yeah. First of all, a big thank you for giving me the opportunity to speak at the Dr. S.N. Mathur Memorial Symposium on vaccine for COVID-19. The contents what I will be talking on: what is a vaccine, what are the types of vaccines for COVID-19, what are the development stages of a vaccine, what are the present vaccines for COVID-19, and what is the future in store. What is a vaccine? Vaccine contains the same germs that cause disease. Germs, I mean virus or bacteria, which are either killed or weakened to a point that they don't make you sick. Some vaccine contains only a part of the virus or bacteria. A vaccine stimulates your immune system to produce antibodies exactly like it would do if you were exposed to the disease. Antibodies are molecules which are produced in the body to eliminate the bacteria or the virus, in this case, the SARS virus. after getting vaccinated, you develop immunity to that disease without having to get the disease first. This is what makes the vaccines such a powerful medicine. Unlike the medicines which treat or cure diseases, vaccines prevent them. Now, coming to what are the different types of vaccines for SARS-CoV-2. As we all now know, SARS-CoV-2 is the virus that causes COVID-19 disease. If we see the structure of the virus, it looks complicated, but to understand the types of vaccines, these are the proteins, these are the spike proteins that are involved in the pathogenesis of the virus, and these proteins help the virus to bind to the cells, these proteins. So the idea is to make a vaccine containing these proteins so that the antibodies are raised against these proteins and thereby destroying the virus directly or indirectly. There are 5 types of vaccines: inactivated vaccines, recombinant protein vaccines, viral vector vaccines, RNA vaccines, and DNA vaccines. Coming to the inactivated vaccines, so this is the whole virus which is chemically inactivated. Now this is a vaccine from our India, Bharat Biotech, which I am closely involved in development of this vaccine. The other vaccines are recombinant protein vaccines. This we can use the whole spike protein as such, or a part of the spike protein involved in the binding of the virus to the cell and make a vaccine candidate. The second type of recombinant vaccine is the whole virus particle devoid of the genetic material, which again putting into the body raises immune response to eliminate the virus. These are now towards the right side. These are little untested vaccines. However, the RNA and the RNA vaccines, the Pfizer vaccine and the Moderna vaccines, which we are lately hearing for the approval, are very recent ones. And till date, there are no RNA vaccines approved in the whole world. Now, what is the mechanism for this? The central dogma of life is DNA, which is the genetic material. DNA is converted to RNA, RNA to protein. Now, this protein, if you raise antibodies against this protein, the protein is destroyed and thereby the virus gets eliminated. That is basic principle. So is vaccine making an easy thing? For a normal vaccine to be developed, it takes almost 10 to 15 years. But however, in case of SARS-CoV-2 vaccine, it's taking only 1 to 1.5 years because the whole world is together. Now, after the R&D stages in the vaccine, preclinical testing is done. Now, these are the stages of vaccine development: preclinical testing, clinical testing, and then the final mass vaccination. In preclinical testing, once the R&D is done and vaccine is ready, these vaccines are injected into animals. Now, when it is injected into the animals, first we see is safety of the vaccine. Is the vaccine safe? Safe, it means mild symptoms to moderate to severe symptoms, such as reddening, fever, or even death of the animal. Second, we see is efficacy of the vaccine. The term efficacy is being used in the whole media for the past 2-3 weeks. I'll come to that in later slides. But efficacy is generally the protection level of the vaccine against the disease or against the infection. So here we see efficacy of the vaccine, whether it is protective against the disease or not. And then the virus, live virus, is given to these animals to see if they are protective antibodies. Once the data from the preclinical testing is acceptable by regulatory authorities, it goes into clinical testing, that is human phase. In phase 1, there are about less than 100 volunteers. They have to be healthy, because once vaccine is given, if they get something or the other symptom, we don't know whether it came from the vaccine or is it due to some other thing. So the healthy individuals are recruited and the dose is tested. Dose is here we see to it that higher dose or lower limit of the dose is decided, the optimum limit of the dose is decided. Once the phase 1 is completed, it goes into phase 2. In phase 2, again a little more number of volunteers are recruited, and here the gender, age, such kind of people are then given vaccine and seen. And here the safety of vaccine is studied. Then the vaccine goes into phase 3 clinical trial. Now phase 3 is an extensive clinical trial where the people are divided into groups. One group is given only placebo, and the other groups are given vaccine. Now placebo is only a simple solution which doesn't contain the active ingredient, just a normal saline. These people go into world normal, and then what happens with their report? After phase 3 trial, the vaccine goes into the approval stage. The regulatory authorities approve it for emergency use authorization in SARS-CoV-2 case, and then it goes into commercialization and mass vaccination. So it's such a long process to make a vaccine available to the people. Now, this is a slide that shows how many number of vaccines are being under research on various platforms. At the research stage and at the preclinical stage, there are almost 300 vaccines. And during the phase 1, phase 2, or phase 3, there are almost 50 to 60 vaccines. This is October data. Now it has been increased to 50 or 60 vaccines. So such tremendous research is going on for vaccine development to combat this pandemic. Now, the biggest debate now is vaccines for COVID-19, which is better. Now, this we have been listening in the news, Pfizer, Moderna, the mRNA platform vaccines. The efficacy of mRNA vaccines is almost 90%. What it means is then the next slide. Now, storage temperature of a Pfizer vaccine is -70. It's very difficult, a country like India or more poorer countries, for a vaccine to be given and stored and transported at -70. Moreover, the vaccine life at 4 degrees only 5 days. So this vaccine, even though looks good, but the problem it can face is the transport and to give the vaccine to the common man. Same thing with the Moderna vaccine. All these vaccines are dosage with two dosages with almost 1 month apart. Now, the vaccine which I have worked is the Indian Bharat Biotech Covaxin, the inactivated whole virion vaccine. It is under phase 3 clinical trial, and the efficacy still has to be established. However, based on the phase 1 and phase 2 trial, it looks to be pretty good. The vaccine storage is 2 to 8 degrees, and it's almost now 8 months that we have done. And it looks very good, stable. It's stable, and the data looks quite encouraging. Now, this is what I mean, understanding efficacy of the vaccine. Now, Pfizer did a study for almost 30,000 subjects, and a group of people who took placebo, 185 people reported with mild symptoms, and then the person who took vaccine, 11 members who took vaccine came out with mild symptoms. So the efficacy calculated was approximately 94%. Severe cases, where in placebo group only 30 people reported severe, while the people who took vaccine, there were 0 severe cases. So the vaccine looks very good. So what I mean to say here is the vaccine is helping in reducing the protective nature of the disease. Similarly, in Moderna case, 43,000 subjects were under trial, and out of which in the placebo group, 162 members were with mild symptoms, and only 1 member who took the vaccine with severe, and that was of the age group of above 50. So seeing this data, can I take a vaccine to protect against COVID-19? Should be yes, if you are age group between 15 to 50. The other, if you are away from this age group, still data is being generated, still data has to be studied, whether it is safe for children or for the older adults, still it has to be studied. Only 5% to 10% of the phase 3 trial is studied in older adults. What is the future in store? Until now, it was very uncertain. However, the pandemic is more certain and maybe little nearer. A vaccine is effective only if it is safe, easily accessible, and readily accepted. One message which I would like to give before I end my talk is you are protected from COVID-19 only after 42 days after the first dose of vaccination is given or 14 days after second dose is given. Hence, please take utmost precautions even after vaccination in future. Thank you very much.
Thank you, Dr. Kapil. That was a very nice exposition about the vaccines. You really enumerated structurally how the so diverse vaccines available in our armamentarium differ from each other, and which vaccine or vaccines are best suited for countries like tropical countries and poor countries like India. So that was really nice. You can stop sharing your screen. And the highlight was he emphasized the fact that it was in the news some time back that the minister in Haryana took the vaccine. Probably he was a bit lenient, or he just let down the guard and then got infected in 2 weeks. So what is you have to wait at least 42 days, as Kapil said. After the second dose, 2 weeks after the second dose, the immunity sets in. So it is not. So what we are looking at, what I'm trying to emphasize here is that even after getting vaccinated, the road is long. You need to wait for 6 to 8 weeks before you can think that you are protected. So till summer, we have to observe all precautions, assuming that probably in February, the Tier 1 vaccination may begin. So even after that, you have to take precautions. So till May, at least April to May, we have to live our life as we are living. You have to live with the virus, unlock yourself slowly, and then start to get on with your work. So Kapil, you just stop sharing the screen. Now opening up the chat box to see if there are any questions. Kapil, you can stop sharing your screen. You just press the red button at the top. So there is just one question, and that is directed to me. Is COVID test mandatory for cataract operation in Swarupai Center? Not just Swarupai Center, all hospitals as ophthalmologists, like we are taking that due precaution, because as I enumerated in my talk also, we get almost 4 inches close to the patient. So in the OPD, we need to take precaution. And even in theater, we are taking extra precautions to prevent the spread of COVID. So what is important is not just you being positive or negative. We have to take into perspective the entire set of patients that we are going to operate on that day. One asymptomatic patient may involve spread of infection not only to the other patients, but to the theater staff and the surgeons. So as surgeons, like earlier, all of us used to recruit the theater and then jointly manage the cases. Now the surgeon who is operating is only entering the theater. I am not entering the theater for the last 6 months. I started my surgery just 3 weeks ago. So what is important here is when we are doing cataract surgery, when we are introducing phaco probe, there is a lot of ultrasound energy that is used, and that causes a lot of aerosol generation, and that is first likely to contaminate the theater atmosphere, the staff, as well as the surgeon. So in order to take extra precaution, we have made COVID RT-PCR test mandatory for all patients undergoing any form of surgery in Swarupai Center. Cataracts, to certain extent, we are doing clear corneal incision and minimal incision surgeries now, maybe, but for my glaucoma surgeries, that is a basic rule. No RT-PCR, no surgery. Now I think I have made all the participants, allowed all the participants to unmute if they want to talk. So if you have any questions, there are no questions in the chat box, but if you want any question, you can unmute yourself and ask any panel of doctors and answer you.
Manoj, can I ask a question to Kapil?
Sure.
Kapil, I know the recent little bit scary data with the vaccination was with some neurological complications, especially the facial palsy. Can you comment on that? Is that significant or not?
No, like what is now what is happening is the vaccines, the trial which are going on, still investigations have to go on to know if whatever is happening is because of vaccine or whether the patient has developed from something else. So it is still unclear But keeping in this mind, there are cases where severity is seen, but maybe no death. That is very good, and severity and recovery is pretty much there, but not so high.
Yeah. No, because it was such a coincidence that almost 4 patients had Bell's palsy. So that was the
the investigation. Yeah, the investigation will go on, I think, to understand what exactly is the reason, the cause for the thing to happen. But definitely there are some cases with these mRNA. So that's why the mRNA vaccines are a bit. There's no mRNA vaccine as such till now approved, and this is the first time which is happening. So there may be cases in older adults especially. So we have to wait and see. And the other thing is, in India, mRNA vaccine, they have not done any clinical trials. Genova Pharmaceuticals is the first company to come out with mRNA vaccine in India, and they are going to try what is going to come out in future mRNA vaccines. That might, if that works pretty good, then that might revolutionize the vaccine industry, because mRNA vaccines are pretty easy and very fast. We can produce them very fast, unlike the inactivated vaccine and the other platforms what we have.
Okay, thanks.
I have a question for Kapil. This is Jyoti.
Yeah.
There's a recent information about people with allergies not to take the vaccine. That is the latest that came back few days ago.
Yeah.
And I would really encourage you to emphasize to our community people as to who are the people who will be eligible to take it and who are the people to avoid it as a precautionary measure. Because I'm sure there are a lot of people who have baseline asthmas, allergies, and things like that. So that would be a good caution to give to the community people, as if you're suffering from any underlying lung issues, then to hold off on the vaccine for now.
Yeah, that's a good question. So now, what the vaccine trials have been, the person has to take a vaccine if he's aged between 8 to 50. If he is healthy, then there should be no issue with the vaccine. Number one, and Number two is, if you are away from this age group between 18 to 50, it is better not to take now, because the data still is unclear. And maybe in a couple of months, we will have more data, like even the Bharat Biotech vaccine, Covaxin. Now the phase 3 trial, what we are doing, it involves people who have already been infected. It involves people who have comorbidities. It involves older adults. So these are the age groups. Still data has to come out. So we never, so we never know what would happen. What would happen if a person with some lung disease is taking a vaccine? We never know, because on long-term study, we don't have any data. The vaccines have been made only 5, 6, 8, or maybe maximum 1 year back. So we still don't have data to comment who can take the vaccine or who not. But definitely there is data for age groups between 18 to 50 or 55, 60 even. If they are healthy, there is no doubt they can take the vaccine. So when they take the vaccine, what may happen in due course is we may develop herd immunity.
Herd immunity.
Yeah, herd immunity. So when you are protected, the person around you is also protected. So that happen. That also may take another 6 months. So this pandemic looks like it may end by 2021 if some vaccine comes out. Modest immunity is better than no immunity. So that will out soon. So it might take time.
Is it being given in pregnant women too? That's my question.
No. Pregnant women are not part of any studies. Children are not part of any studies. Older adults were a part of study for Pfizer and Moderna, and even we are doing that, the older adults, but not in pregnant women.
Okay.
There is a question. It's divided in 3 parts. Does taking warm water with turmeric, ginger, garlic, black pepper, lime and immune boosters and 3 minutes minimum steam or 5 milliliters of betadine gargle daily is good preventive measure, or does it harm? Any physician, Dr. Vimal Rai or Nitesh, would you like to take it?
That's question from my side, from Calcutta, Ashish here.
Shankar formulations and Baba Ramdev formulations, how good or how bad are they? Nitesh, you have to.
Can you hear me? Actually, if you see, there has been a lot of discussion on the foods which boost your immunity. But 2 to 3 things are there that they help, but no data has shown that they are protective. So main is social distancing, wearing mask, washing hands. They are the main things. These have been shown to help in some way, but there is no confirmed data that they are protective. And one more thing I would like to talk about the PPI. Vimal uncle told that PPI are very important. I agree with that. My talk, what I told was that in patients who are taking PPI without any indication, proper indication, they are the group of people who should stop those. But if the PPI have been prescribed and if the person has been indicated by a doctor to start, they should continue.
The second question is what precautions?
Nitesh, you didn't answer my betadine gargle and the daily usage of.
Yeah, betadine gargle has shown to be protective, but we do not have confirmative data on that. They have been shown to be in some studies, especially which are company driven, that it protects.
Oh, thank you. Again, one more question I have was what precaution need to take in the cold, misty areas in Calcutta? It's totally misty now. It's foggy. What precautions we need to take to prevent?
The same things you have to do. No, wear mask, social distancing, keep yourself warm.
Okay, Manoj, can I comment one thing?
Yeah. Sure.
This is Vinay. Especially for all the Biradri members, just be careful with the dose of vitamin D, zinc, and vitamin C you're taking, because there is a lot of data from India which is pointing that a lot of people are overdosing, and that is harmful. Because I know this is over the counter and people are taking really high doses of these things. So zinc toxicity, vitamin D, and vitamin C has to be please watched and take in an adequate dose only, what is recommended. The other thing, Nitesh, I just wanted to point, I think there was some data that Pepsid has shown to be beneficial in these infections. I don't know what's the GI thoughts on that, because I know the other antihistamine, but somehow there has been data that people who are taking Pepsid have done well with the course of the disease.
Yeah, I agree with you. Amoxicillin has been shown to be beneficial. H2 receptor blockers are superior to PPI. There were 2 trials on meta-analysis which they have shown that if a person was on a double dose PPI, when compared to a single dose, those who were on a double dose of proton pump, they had a very bad prognosis with a very severe COVID. But if they were on H2 receptor blockers, there was no side effect. I agree with you.
There is another question. Please advise where and when to get vaccinated and also get RT-PCR diagnostics in Hyderabad. Almost all PHCs are doing this, but basically they are doing antigen testing, rapid antigen testing, and RT-PCR centers. There are at least 30 centers available on the net. You can select the closest center to you. Vijay Diagnostic Center and many sub-centers are, collection centers are there. You can get it tested. And
Manoj, if you can put that list of centers on the site or at the community site, it will be helpful to the Biradri members, because most of them wouldn't know where to go.
Yeah. The Telangana government website is there. On that, all this information is available. The addresses of all the peripheral centers where so many centers are available. You can select any nearest center or any diagnostic center. And if not the direct center, one center I can say Vijay Diagnostic Center is doing it. There are many collection centers available all over the city, and you can give your sample through them. And they collect, as Sajid said, they collect your Aadhaar card number and your track. If you are positive, the government will telephone you and keep track of you every day. And Kapil, would you like to answer this question? What is your advice when to get vaccinated? Suppose, like all health workers, we are all enumerated, like all doctors, we have given the list. We are in tier 1. Is it safe to take vaccination in tier 1 or wait for wait for 2 months, see the response? And
when the vaccine is
emphasize here is, before you answer, I would like to make one more point. All the studies are in the age group of 15 to 50 and then 65 upwards. So what about us between 50 and 65?
No, it's not like that. It's like various vaccines have done their trials on different age groups. So the data available is again up to 50 only. The confident data, what I mean is confident data, there's always that age group which above 50 is a bit circumspective, but okay. But definitely these vaccines are going to be safe, and no regulatory authority is going to give approval if they're not safe. And this the government of India also is very much giving emphasis on the safety of the vaccine. Because so to take the vaccine, when the vaccine gets approved, yes, definitely it can be taken. That is not a problem. And so way to take the vaccine, definitely. I think government of India is planning how to distribute the vaccines, because still a vaccine from biotech might take time, but Moderna and Pfizer are front runners for that, and I'm not sure if government of India is ready to take them. For reason being, these are the first mRNA type of vaccines, and second, the transportation of the vaccine, the storage of the vaccine, the costliness of the vaccine. So keeping this in mind, it might take time, but when vaccine available, it will be a good vaccine, and it can be taken for healthy individuals.
And a related question regarding vaccines is, should an infected person also be vaccinated? And if it is a healthy patient, should an antibody test be done before taking a vaccine? Suppose if antibody is positive, is vaccine indicated?
Yeah. It is. For that also research is going on, but it is now for example, I am vaccinated now. So my antibody levels are being checked regularly. And now it's been almost 3 months and my antibody levels are pretty high. So antibody levels, it doesn't mean that antibody levels should be there. What it means is neutralizing antibody levels should be high enough. Neutralizing antibodies are the antibodies that kill the virus. So like coming to your question,
I think the answer for that is only time will speak. Whether we have the protective immunity or the neutralizing antibodies or the protective antibodies, that I think that can be given only as time goes by, because there are studies there, they have shown that when these antibodies appear, nobody is sure whether they are short term or they are long term.
Now it has been seen that patients who have already been infected, the antibody levels are still there after 6 months. It has been disappeared. There are cases where antibody levels are falling down very drastically, but still the protective antibody levels or the memory cells are still there. So infection, the body still recognizes and produces antibody again, so that the virus is safe.
Yeah, but I did have 2 cases here in US in my practice where patients were infected. They were positive with the test. Then over a period of time, they were followed, they were negative, and they're retested after a couple of months, they again become positive. So even if you have those antibodies, we are not sure if they're 100% protective or not, because the reinfection is again happening in spite of being tested negative. So there's no answer to that yet.
The research has been done on this also. So one of the research says that the virus lingers around inside and then it adapts itself, it mutates. So if we do the sequencing of the virus and all, we may find out surprisingly, it may not be the same strain that infected the person before. It might be another strain that infected. So still, this is still very, very new for this.
Preliminary.
Yeah, preliminary. This is still preliminary. But it has been seen that virus is there. It may not be replicating, but virus gets adapted to the human system and mutates accordingly. And once that mutation occurs, then the strain is different, the vaccine is different. So that would.
So what is your thought about the different strains that have been detected with this COVID virus? There are some different strains they have identified in different parts of the world.
There are strains. That is why the efficacy levels are pretty low, like 60%, 80, 70%, 80%. That is the reason, one of the reasons that the efficacy levels are low. And maybe in future, we should see which is the most common strain. For example, Bharat Biotech strain, what we took in May, is almost covers 95% of the strains which are floating in India, at least.
Yeah, the other question is, just like the flu virus, whether we will be manufacturing this vaccine on the present strain, but going forward, what if the virus mutates and have another strain? Then
yes.
How do we protect ourselves then?
Yeah, this is the reason why many vaccine industries are targeting mRNA technology. So mRNA technology is very simple. We can modify it, whatever strain of the virus. We have to just change one or two whatever mutations that happen. Do it. It can be done very fast because the program is already tested, so it can be fast tracked. So that is why people are going into mRNA kind of a platform more than the inactivated or any other.
That is
The next question I would like to direct it to our president, Dr. Dinesh Raj. It has social connotation as well as the connotation that Dr. Dinesh Raj is associated with the policy formation of the government of Telangana. He is a consultant to that panel. So the question is, what is the plan for the vaccine to be distributed in Hyderabad, and how can the Birani members get it? Do you have a plan to get a consignment for HMK? Dinesh, you have to unmute. What is the government's plan for vaccine distribution?
1 minute. Can you hear, Manoj?
Yes, you can proceed. Yes, you can proceed.
I think he muted himself.
Yeah, you have to unmute. You have to unmute. You're muted.
Okay.
Yeah.
Well, first question, I would like to comment on Kapil and Jyoti's discussion. Jyoti, that as far as our knowledge goes, the COVID-19 virus has not undergone much antigenic drift. Minor shift is there. Minor shift is there from 614 to 2614G. So that has happened in so many months. So they are thinking that it is good and the vaccine can be manufactured against that particular strain, and it will remain for a long time. Another thing is that we have been noticing in our government practice that they are reporting relapses of the cases. Though we were telling that there are so many antibodies produced by the patients after you test the patient after 14 days of illness, antibodies are there, but still these patients are getting relapses. So they are doubting whether the antibodies are short-lived, they may go away. But now Kapil has said that the antibodies are seen for 6 months and beyond that. So it's a good this thing. So we have to still wait and see whether these things are, how far they are true and useful to our knowledge. Now coming to Manoj, your question the government has now asked all the medical institutions and healthcare workers list that they are going to provide the vaccine first to these people. They are thinking, and they want to first protect the healthcare workers. Then only it will be given to other. That is the so far the policy of the government. Now, when it becomes free for all, I'm sure I will request the government to give special preference to HMK.
Thank you,
members.
Yeah, one question has really generated anxiety among most. The question is directed to Nitesh and Dr. Vimal Rai. They want specific advice about PPI and acids.
Yeah, I told very clearly that if you are taking proton pump inhibitors like omeprazole, lansoprazole, just as prophylactic without any clear indication, then there is an increased risk for getting infection. But if you have been prescribed by a doctor or you are having a GI condition in which you have been prescribed to take it, you have to continue it. So I hope I am clear.
Yeah, the other questions are all related to immunity and the development of antibody issues. I think those questions have been adequately answered. Like, with the permission of the President, Dr. Dinesh Raj, would you like me to conclude the session?
I think yes, we had enough, and I'm extremely thankful to all the speakers. They have lucidly given the detailed picture, and I'm happy that all international colleagues of ours also participated. We welcome you, we thank you, we continue. I request you all to continue participating in our future seminars, also on different disease conditions. And thank you once again to all our viewers who have participated, taken active participation, and did definitely encouraged us. So, Manoj, please go ahead. You have done very good job. Congratulations.
Thank you, Dr. Dinesh. So, my proud privilege, like a very interesting aspect is the last SN Memorial Health Camp. I was the convener, and after that there was a lapse, and it is my privilege now again to restart the activity of SN Mathur Trust. Though we planned it a regular camp this year in the month of October, that could not happen because of the pandemic. But we are trying to do our best by these online activities. So it is good that we have succeeded today in restarting the activities of Dr. S.N. Mathur Memorial Trust. And on behalf of the trust, the chairman, Dr. Vimal Rai, is here. The convener, Mr. Jayant Kumar, is here. Like, on behalf of the trust, I would take the liberty to inform all the members that we will be conducting SN Mathur Health Camp for the betterment of our society regularly from next year. So before I conclude, I deem it my privilege to thank our president.
1 minute, Manoj.
Yeah. Yes, Dinesh da?
1 minute, Manoj.
Yeah.
I would like to thank Rekha Chandra and her team for the good efforts and a successful conduct of this particular camp.
Yeah.
So thank you very much, all of you. Manoj, go ahead.
Yeah. Thanks.
And also I thank S.N. Mathur, Dr. Vimal Rai, and Guru.
Yeah. So we are from the Medical and Health Subcommittee, on behalf of Dr. Rekha Chandra as the chairperson and myself as the convener, and our health committee members, we accept with humble thanks the vote of thanks from the president. And I would like to thank also the chairman and the convener of Dr. S.N. Mathur Trust and all its members. And I would like to thank all the speakers for the day. All of them spoke relevant to the point, though we planned a somewhat shorter session, but we really didn't feel the time. We wanted to wind up the show in about 2 hours. We exceeded by almost an hour, but I hope all the attendees, they enjoyed, and they were wholeheartedly involved and engrossed in the talks by all the speakers. At least on my behalf, I didn't feel that we have spent 3 hours online non-stop. So I would like to thank all the speakers and all the delegates who attended this symposium today in memory of Dr. Narayan, and we will continue.
No, vote of thanks to the wait, Manoj, wait, I would like to see.
And HLK Education and Welfare Society. Last but not the least, I would like to thank our president once more for his guidance and from time to time, and his guidance is invaluable for all the subcommittees to present their activities through online activities this year. The next activity is already announced. It is on 27 December by the School Education Subcommittee. They are organizing a Chamakte Sitare event. So I request all the Biradri members to follow their relative groups, go through the details and contact Madhu, Nishi and Mrs. Nishi Narayan, Mrs. Nelata Pratap and Mrs. Madhu Mathur, and enroll their children and make that event also a grand success. So thank you once more. Now, Dr. Vimal Rai, would you like to say something to come before we conclude? You have to unmute and yeah.
You have on behalf of SN Mathur, camp. I would definitely like to thank all the speakers who have really taken part in this. It is my proud privilege to tell that the standards have been extraordinarily good, both from medical point of view as well as from general point of view. We had a very good discussion, and that keeps us going further. And it is without doubt that I will tell that SN Mathur Memorial Camp has been the game changer in our Biradri, because after that camp, people became really conscious about their health, and at the same time, the lifestyle changes had come in. Thank you once again.
Thank you all. I'm ending the meeting now.
Thank you. Very informative, very encouraging. Keep safe.
Thank you. Thank you.